Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, everyone, and welcome to 5 to Thrive Live. I'm Karolyn Gazella, and I co-host this show with my good friend, Dr. Lise Alschuler. Today, we will explore the connection between chronic inflammation and mental health issues. By focusing on healing a key underlying cause of mental illness, my guest is redefining psychiatry. Dr. Jaquel Patterson is an integrative health expert who applies her naturopathic training to helping patients in her clinic, Fairfield Family Health in Fairfield, Connecticut. She is also a best-selling author and a highly regarded speaker and educator. But before we dive in, I'd like to thank our sponsors, beginning with Cetria, a patented form of glutathione, clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps support respiratory health. For more information, visit cetriaglutathione.com. Also, cognizin citicoline, which is nature's way of keeping the brain's energy-producing centers firing on all cylinders. If you're looking for a way to enhance your brain function, including memory, focus, and attention, look for cognizin on the label or go to cognizin.com for more information. ProThrivers Wellness Brain is a product that contains cognizin as well as other brain-supporting nutrients and herbs. You can find ProThrivers Wellness Brain online at pureformulas.com. There's also ProThrivers Wellness Sleep, which combines higher dose melatonin and other sleep-supporting natural ingredients specifically designed for thrivers. You can find ProThrivers Wellness Sleep also at pureformulas.com. And Dr. Ohhira's Probiotics, it's a best-selling probiotic for more than 30 years, and it contains 12 probiotic strains that are shelf-stable, so no refrigeration is required because of a unique 3-year fermentation process. It's a very effective probiotic. Learn more at drohhiraprobiotics.com. Well, Dr. Patterson, welcome to 5 to Thrive Live.
Thank you. Thanks, Karolyn, for having me. Really excited to be here on 5 to Thrive to have a discussion about really important topic on the inflamed mind and how psychiatric conditions are impacted due to it.
Yeah, it's an important topic, and I love the angle that you take with mental health. But before we talk about specifics, why are you so interested in focusing on this connection between inflammation and mental health?
Well, I myself I was a person that had Lyme disease, also Bartonella and Babesia and my own infections, and also had family history, my mother with autoimmune conditions and many members with autoimmune conditions. So, these different disease conditions that lead to inflammation and inflammatory states. And so when I actually had it myself, one of my biggest symptoms were symptoms that were very psychiatric in nature in terms of like anxiety, shortness of breath, air hunger, palpitations, insomnia, hot flashes. And I was way too young to be, I was in my later 20s, so way too young to be in perimenopause, but having a lot of symptoms of even like excessive sweating. And so when I started working with patients in the realm of tick-borne infections and individuals with chronic disease conditions, what I found was almost about 40 to 50% of them had some type of impact on their state mentally, either anxiety, either depression, either mood dysregulation and irritability. And so I found that when I supported or, when their disease conditions got better in terms of helping with that, their mind also got better. And so I started looking at this connection more of what inflammation's role is, and spent an extra couple years in functional medicine, psychiatry, studying and learning so that I could be just more adept in helping my patients walk through that.
Yeah, I mean, to me, I've written about chronic inflammation a lot. We talk about chronic inflammation on this show a lot, and the connection does make sense. But remind us, how are chronic inflammation and mental health connected?
Yeah, so there are many different reasons why we can have what's called when we're looking at our mind. I always say like leaky mind, leaky brain, leaky gut. So there's are some connections as well with when we look at things like gut health. But there are many different reasons for to initially cause what we call neuroinflammation or inflammation to the brain, many different triggers. So one, some people obviously know things like concussions and traumatic brain injuries. But another huge factor is bacterial, viruses, infections like tick-borne diseases that will actually disrupt what we call the blood-brain barrier, which causes inflammation, these inflammatory mediators to get elevated in the brain. We also look at, when we're doing chronic disease conditions like type 2 diabetes and also aging, which we call inflammaging. All of this, when we look at inflammation as a whole, it's the chronicity and also the acuity, how significant of an inflammatory event it is. So it could be a combination of multiple factors, even outside of bacteria, virus, tick-borne illnesses. It could also be, trauma. It could be other chronic disease conditions a person has. Stress will also, chronic cortisol dysregulation will cause an issue with things like neuroinflammation and impacting that blood-brain barrier. So it's multifaceted, but what you'll see is that these infections, especially if there's a chronicity to it, will definitely cause some of these inflammatory mediators to be impacted, which thereby initiate these mental health issues.
Yeah. So how can we tell if inflammation is a factor with mental health? Are the symptoms different? And what are the symptoms?
Mm-hmm. So interestingly, if we look at the inflammatory mediators most impacted for neuroinflammation, the interleukins, IL-1, IL-6, and also CRP. And to your question, Karolyn, that's the tricky piece, is that those also get elevated when you have chronic disease and chronic inflammation. But when you look at studies, things like CRP, which is C-reactive protein, which is a test you can check out through your labs, that any individuals that have CRP levels greater than 3 are greater at risk for depression. Or if you look at interleukin 6 and CRP, both of those numbers will go up. Even in fact, they've looked at it for schizophrenia, that these CRP levels will elevate and IL-6 will elevate significantly before even a first psychotic event. And then when you look at many of these conditions like hypothyroid condition, you'll see, and diabetes, much higher rates of depression and autoimmune conditions. So there's definitely that overlap. And to your question of, how may the symptoms present? The symptoms present very similarly, and the same areas of the brain are affected. When you look at things like anxiety, the amygdala is affected, the prefrontal cortex is affected. When you look at things like depression, the prefrontal cortex also is impacted, as well as hippocampus. So these all relate to like cognitive function. When you look at hippocampus, memory, and that's why you'll see someone that has chronic anxiety or depression, there's a lot of forgetfulness and short-term memory issues. Or ability, if you look at the amygdala for anxiety, like everything is a fear response. Everything is responded as a kind of an emergency situation. So these things can get dysregulated, and they present with very much the same exact symptoms, because the areas of the brain that are impacted are the same areas of the brain that are impacted with those mental health conditions.
So the concept is that when we heal the chronic inflammation, the mental health issue also gets healed.
Yes, and that's what I'll often see, is that when I work on, for example, an individual that has Bartonella, and we work on that infection and rid of it, you'll see their mood and temperament gets better. And I even have that noted often with family members, where a family member will ask that question if they'll notice, a change in a family member's mood or behavior or anxiety level. So you will definitely see that adjustment once those infections will actually clear. And I might also have to do support directly, like I would do for any patient with anxiety or depression, where I might need to put them on things for just general neurotransmitter support. But what I'll see is I need less of that support as they get better. Another factor to consider for any practitioners or anybody listening in too is if somebody has to keep changing, for example, their psychiatric medication where the dose needs to keep going up higher, or you need to keep, you need to add in 2 medications or 3 medications, there is a connection that the inflammation, if inflammation is not managed, you'll see someone does not respond as well to psychiatric medications. And so that's often what I see as well, where someone, as they start getting better, they need to be on less psychiatric medications, or if they're really inflamed, they're on, instead of 1, they might be on 3 or 4 medications, or the dose needs to keep going up as they also are dealing with this chronic disease state.
And the cool thing is we know that chronic inflammation can affect other areas of health. So when you heal that, it's not just the brain that gets healed; it's the entire body and overall wellness. And I know that you use a very highly individualized approach. But I want to talk about some foundational things, beginning with diet. Are there things that you focus on from a dietary standpoint to reduce inflammation in the brain?
Yeah, so if you look at the studies as it pertains to psychiatric health, the diets have been something called the MIND diet, and the MIND diet is actually very similar to the Mediterranean diet. So MIND diet, Mediterranean diet, as well as the ketogenic diet have all been studied to help to support mental health. So these are typically one of the biggest things is it's rich in flavonoids, and there's tons of studies to show flavonoids and high levels of antioxidants. Those are going to really help to decrease inflammation and will help with mental health as well. Things that are like when you look at Mediterranean diet, it's higher in things like omega-3s, and also you have higher amounts of then EPA and DHA, which are all protective for the brain as well. So looking at higher consumption of with the protein with fish versus red meat, and then things like the Mediterranean diet where it's higher in these antioxidants, which are very helpful for the brain health.
Yeah, we love talking about the Mediterranean diet, and also the Mediterranean diet. People eating that diet eat less highly processed foods, and it's a cleaner diet. And so, yeah, that makes a lot of sense. So, what about from a lifestyle perspective? Where do you place your focus when it comes to lifestyle factors?
Yeah, so several different factors. So sleep and mental health actually have definitely a bidirectional relationship. So much so that they've even done studies that have shown adolescents and young children that do not get adequate sleep have a much higher risk for depression later in life. So sleep is a huge factor for just immune function, immune dysregulation. So we're always working on that as part of just like a baseline foundation. And I find sleep is something that people can at least make some small baby steps of improvement that they can actually feel like they can manage. So that's one piece. If you look at lifestyle by way of exercise, on average, when it comes to anxiety and depression, it's about 3 to 4 times a week, 45 minutes of workout of a mix of both cardio and like strength training. And they have shown an inverse relationship if it goes over 45 minutes 4 times a week, that it might be mental health wise, it could actually have a negative impact, because there's the balance of doing too much, and also the impact on like cortisol dysregulation and things like that. So generally it's about 3 to 4 times a week, 45 minutes. I will often try to get people, especially if you're, type A, like myself, doing something like walking for longer periods of time. If somebody has adrenal fatigue or any kind of dysregulation, will be a great way into that, and also gives them a chance to connect in with nature. There's been studies on even that. When I talked about nature, forest bathing actually decreasing inflammatory markers and helping with their immune function even 30 days after looking at studies in Japan. And then the other thing I like, if you have access to, is sauna. There's been several studies on the sauna. Sauna has been studied to show help cardiovascular function. It helps to decrease the CRP levels, which I mentioned as that inflammatory marker. But they've even had in the studies in Finland, studies of over 2,000. It was men. There were men only, but over 2,000 men studied in Finland over a course of 25 years. And what they found was the more frequent they did sauna bathing, the less likely they were to have mental health conditions, particularly anxiety, depression, and schizophrenia. So that's another great adjunct that people can do that also, is self-care as well for themselves.
Yeah, it's great stuff. We've done entire shows on green exercise and being out in nature, and so I'd like to talk about specific nutrients and herbs. But first, I want to know, what is your overarching view of how dietary supplements can potentially help heal chronic inflammation?
I think they are very much needed and necessary because we try to get as much as the foundation piece supported, like I mentioned, sleep, exercise, and then obviously diet. But unfortunately, we just can't get as much of nutrients that we want or in high enough of a nutritive value that we need just from the diet alone. So especially if someone has a chronic disease or are high inflammation or autoimmune conditions, et cetera. So nutrients are often needed to be able to add at a level that is therapeutic to be able to have an impact on really shifting them back into homeostasis.
Yeah, I would agree. I think that you're correct. And you can use like turmeric as a great example. There's no way to get enough curcumin with diet alone. So that's why, that supplement is so needed. So let's talk nutrients first. What are some of your go-to nutrients, maybe foundational nutrients that can help ease inflammation?
So Karolyn, you just mentioned one of them that I love is turmeric. And they even had in some of the studies that turmeric, when you mentioned consumption, that the higher amount of turmeric, like consumption or curcumin consumption, the better your ability for stress resilience. It was like 4 to 5 times better stress resilience just from people that frequently consume that in their actual diet. But turmeric has been heavily studied for depression. Actually, the most clinical studies for depression or for turmeric rather have been for turmeric and depression. And so the reason being that turmeric has studied to show to help with IL-6, which I mentioned earlier, which is an inflammatory mediator to basically down-regulate that. And so what you'll see is if someone is taking higher amounts of turmeric, their inflammation will go down and also their brain health will be better. So turmeric is one that's been studied. And I love to use things that I find can overlap. So things like turmeric or ginger, which also helps with, ginger helps with digestion. It's also shown to help with serotonin levels. People don't think of it for neurotransmitters, but it helps with the neurotransmitters as well. So I might look at things like that. And it's also an anti-inflammatory, especially if someone is having joint pain and physical pain. We can get things like turmeric and ginger that not only help with those issues that many of my patients are struggling with, but will also help with their mental health state. So when I can look at things that are combinations, those are really great. So turmeric, ginger, as I mentioned, there are a lot of specific herbs that have been studied for different tick-borne infections like cryptolepsis, artemisia, Japanese knotweed. Those have been studied and shown to be as effective, sometimes if not more effective than some of the antibiotic treatment like doxycycline. So I might add in some of those specific herbal protocols if I'm working with somebody with the tick-borne illness. Rhodiola. So I also like to look at adaptogens. So Rhodiola rosea is an adaptogen that not only helps with physical stamina, your ability to manage stress, but it also helps to downregulate COX-1 and COX-2, these inflammatory pathway. And it also increases up norepinephrine, epinephrine, dopamine. So those are all neurotransmitters that get impacted as well due to neuroinflammation. So if you look at neuroinflammatory events, you'll see that, for example, like the dopamine levels will go down, and dopamine is actually neuroprotective. You'll see things like GABA and glutamate. The relationship between those get impacted negatively, and GABA is also protective for the brain. So things to help support those neurotransmitters, like a rhodiola, like core essential amino acids like tyrosine or tryptophan. I look to support, especially for if I have younger people, because they're often not getting enough, for example, amino acids through good proteins in their diet as well. So tons of different ways to do it. But what I try to look at is how do I address many things too in maybe one herb or one supplement.
Yeah, you kind of get a twofer or sometimes a threefer.
Mhm.
And I'm glad that you mentioned adaptogens because I was going to ask you about that. And you mentioned rhodiola. What about ashwagandha and ginseng and mushrooms and some of the others, or is rhodiola kind of the go-to for mental health?
So rhodiola also has been studied, interestingly, for ADHD. Ashwagandha is a great adaptogen, and I usually will use that too for individuals that need hormone support. So ashwagandha helps with testosterone. It can also help with thyroid function. So like you said, with the twofer, if I have somebody that has those things as well, I might want to look at that. But in general, all the adaptogens are going to help with stress resilience. So they're definitely going to be supportive in that way as well.
Yeah, they're really powerful substances. I know that you do a lot of lab testing.
Mm-hmm.
Do you find, like, you probably test for nutrient deficiencies? Do you find that there are some common nutrient deficiencies that you may have to address in clinical practice with some of these inflamed patients?
Yeah, so I say the top ones I've seen, iron has been a big one. Now, I think I would say when I first started practicing, I would do the regular, what's called complete blood count, and you would see people's hemoglobins, and I would kind of use that as a general guideline. And I would say in conventional medicine, that's pretty typical. But then I started noticing, especially after 2020, a lot of people becoming with just having chronic fatigue, that I started testing iron and ferritin more specifically. And I found a huge percentage of my patients that became, iron deficient or had lower ferritin levels post-infection. And so one of the reasons ferritin is actually an acute, which is one of the markers they look at ferritin for anemia, iron deficient anemia. That one, ferritin is also a marker that will go up as an acute inflammatory marker. So you'll see sometimes when people get ill, it'll go up and then it'll go down. So iron is definitely one of the ones. I also look at core minerals like RBC magnesium, RBC zinc. Vitamin D was a huge one, especially anybody that's lower than 40. A lot of studies have shown increased progression of chronic disease conditions if the vitamin D is less than 40. So I definitely look at those core nutrients in addition to some of the inflammatory biomarkers I mentioned, like CRP, ESR, and I might look at things like IL-1 and IL-6, as well as IL-10.
Yeah, and it's interesting because when you find the deficiency, correct the deficiency, the relief comes pretty quickly, doesn't it?
Yes, it does. And if you look at something like, iron, I've had some people that have, so the range, for example, with iron is 16 to 250, and I have people at like 2 or 3. So if you give someone like that iron, I mean, they feel like a completely new person. So that is always great when you can support on the bottom line, like that their foundation is stronger, because yes, we can work after and go after the infections, and yes, we can help them become less inflamed. But if you don't have enough of that, that base foundation of something as simple as iron, then it's going to be way longer journey to recovery. So I think those things are always the first things I'm trying to adjust so that people can also feel better sooner than later.
Yeah, exactly. So what final advice do you have for listeners who may be struggling with mental health issues like depression or anxiety? What final advice do you have?
Yeah, so I would definitely suggest for any provider you're seeing, if they're looking at the full physical piece of you in terms of other disease conditions that you may have that may have been overlooked. Obviously, area of focus for me is tick-borne illnesses, because that definitely can instigate mental health conditions, but it could also be other things, autoimmune conditions that haven't been fully worked up, or thyroid conditions, or Hashimoto. So you really want someone to fully investigate if those other things are contributing. And particularly, as I mentioned earlier, if a medication's not working, or you keep going up, or something was working before with your medication and it's no longer working, those are all flags of, is there something that's preventing the medication that worked before to no longer work. And so those are all questions you should ask in, and making sure that you maybe are not seeing the person only for medications for, let's say, psychiatric conditions, but you're also following up on all your regular, medical care needs as well, to ensure that those aren't actually making the issue worse as well.
Yeah, I mean, it's such a good point. It's a cornerstone of naturopathic, functional, integrative medicine, getting to that underlying cause. That's what you doctors do so well, and I think that that's really important. And you mentioned the medications. Oftentimes, that's very frustrating for a patient
Mhm.
when they're layering on more medications, and the medication stops, and they have to start again, and that can be hugely frustrating for patients. So. Well, this has been great. Where can people find out more about you and your work? Do you have a website you'd like to share?
Yeah, so I'm based in Fairfield, Connecticut, but we do provide telemedicine since we have licenses in multiple states. So the website is Fairfield, FAIR, fieldfamilyhealth.com. And you can also find us on Instagram and Facebook, as well as LinkedIn at Fairfield Family Health.
Yeah, and listeners, check out Dr. Patterson. She is a wealth of information, and follow her and check out her website, fairfieldfamilyhealth.com. Dr. Patterson, this has been wonderful. Thank you so much for joining me today.
Thank you. Thank you so much for having me. I really enjoyed the conversation.
Yeah, you're doing great work. Well, that wraps up this episode of 5 to Thrive Live. Once again, I'd like to thank our sponsors, ProThrivers Wellness Sleep Formula, Cetria Glutathione, the superior glutathione to support liver and immune health, Cognizin Citicoline to help enhance memory, focus, and attention, and Dr. Ohhira's award-winning shelf-stable probiotic. I also want to remind our listeners that you can find past episodes of 5 to Thrive Live at ithriveplan.com. That's ithriveplan.com. All right, may you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.